what I want to get across, cigarettes affect your lungs, that's in general. Alcohol affects your liver, as far as most people know. Marijuana affects your brain.
Changes the frontal lobe, drops the IQ by an average of 6 to 8 points, even in adults, and it does not return to normal. And there is a direct link between marijuana and mental illness, especially if you're predisposed, because we know that marijuana turns on the gene that carries mental illness. It's a COMP gene.
The younger you start use, and the more frequent you use it and the higher potency that you use, the more likely you are to start exhibiting psychosis.
So what are we going to, like 10 years down the road, we're going to have a lot more schizophrenics? I mean, that just doesn't make any sense.
I started to notice how it affected me.
Kids will dab out, meaning they hit the high-end marijuana, and they black out. And they wake up 3 to 4 minutes later, they can't remember anything, they become extremely anxious, then they're terrified, then they become psychotic.
The common people would say that's somebody who's going crazy. That's what would be the common term for psychosis. But to put this into picture, this is somebody who the police are bringing in, they're screaming uncontrollably, usually about some sort of active hallucination they're having. They're requiring 4-point restraints, meaning they've got to be strapped down to the bed. They're spitting at you, they're screaming that somebody's coming to get them, that God has commanded them to do something. All of these just clear active hallucinations that would go with psychosis. They're clearly paranoid, and they're clearly not in their right state of mind.
And so that's kind of what we're seeing on street corners and in parks and things, and people are kind of out of touch with reality.
We see that probably close to every other day in the emergency department, that somebody's coming in with that degree of psychosis. And the only thing found positive in a majority of their urine drug screens is cannabis.
I see addiction as a disorder of the learning and memory part of the brain. It's affecting the part of the brain where we learn to do everything. So everything we learn creates dopamine release in our brain, in the nucleus accumbens, which then reinforces memory about that, and then it gets hardwired into our brain. And we have this pathway on purpose because it helps us remember to eat, to procreate. I mean, it helps us to remember important things. And there is always this release of dopamine. Well, what happens is the addictive drugs work in the same pathway, only they cause an even more significant release of dopamine. And then they basically then hijack that part of the brain.
Not everybody that drinks a beer becomes an alcoholic, but the more people that drink, the more alcoholics there will be. And the same thing with marijuana is not everybody smokes marijuana becomes addictive, but the more people you introduce to marijuana will lead to more people that become addicted to it, both physically and chemically. And that's what I saw when it did become legalized.
I mean, I understand that it's difficult to make it in America today, it really is, but it's certainly even more difficult when you have an addiction and people are addicted to pot. I mean, I see it. And I don't see how people think that that can't happen.
The great lie of the marijuana industry is that marijuana is not addictive.
Marijuana is absolutely addictive. You know, it always takes me back to the old cigarette commercials that my dad used to joke about.
I have an old adage, you know, the first one's free and I have a customer for life.
Once THC got over 5%, that's when we saw the very first marijuana dependent syndrome diagnoses. It's actually in the DSM-5. People will say it's not addictive. And the medical industry doesn't respond to that much because they're like, it's in the DSM-5, of course it's addictive, we know that it is.
We discovered that there is a true withdrawal syndrome with marijuana. And the symptoms are basically anxiety, irritability, can't focus, can't concentrate, can't sleep. And this is where people get violent. They get very irritable because they don't have this substance that they've been addicted to.
We know that 1 in 4 youth get addicted. Now, if we were able to determine who that one was, that would help us. But what they're doing with the money, if you really follow the money in Colorado, they're utilizing a lot of the money for drug rehab programs.